Yes, Ebola is a fearsome disease. This is a pathogen unlike anything that we've ever seen before. But I know the power of ozone and oxidative therapies. I know it. I wouldn't be doing this if I didn't have absolute confidence that we're going to dramatically cut the death rate.
You need some type of weapon to fight these outrageous potential epidemics that might impair us.
My own belief is we will slash the death rate in these people. That's what I expect to see, or I wouldn't be doing it. And if we do that, we're going to give a lot of hope to the world.
Ebola has been in the news, creating lots of fear and concern. So what is the real truth? Hi, this is Dr. Mercola, and today I'm joined by Dr. Robert Rowen, who has been with us many times before, and he's going to help us expand on that answer. And he has actually been invited by the president of Sierra Leone to go to that country, and he's leaving very shortly as we're doing this interview, to use oxidative therapies to treat Ebola, and we're going to go into that in more detail. So welcome, and thank you for joining us today.
Thank you, Dr. Mercola. It's a real pleasure to be with you again.
Can you give us a little backstory to get people up to date on what the current process is?
Well, your viewers know that I do oxidative medicine. I do ozone, ultraviolet blood irradiation therapy, high-dose vitamin C. All of these collectively belong to a family of therapies called oxidative therapies. And in my opinion, and I've been doing them longer than any other living person in North America since 1986, in my opinion, especially ozone and ultraviolet are among the most powerful therapies for healing across the board of anything I've ever seen in my career. They can do more to help more conditions, especially ozone, than anything else. And why ozone? Because it's much more versatile. You can give it any number of ways. And your viewers, some of them may have gone to my YouTube channel, Robert Rowen, MD, all one word, ROBERT, ROWEN, MD channel, to see what these therapies can do. Right now we're faced with probably one of the most horrific epidemics humankind has ever known, and that's with a virus called Ebola, that is transmitted by personal contact, bodily fluids, and actually it may be airborne. There is some evidence that it could be transmitted airborne. What I don't know, and I'm trying to investigate, is how easy it is transmitted person to person. I'm not sure that it's that easy to get, because if it was, everybody should be dead by now in many of the villages, and not everybody is dead. Then on the other hand, we know that there are aid workers who have gotten the disease and died even wearing full suits. Maybe they made a mistake with their gloves or something. So this is really a terrifying situation. And anybody who works with Ebola is putting their lives on the line, because there are no conventional therapies for this. None, except supportive care, like giving IV fluids, giving oxygen, maybe giving heparin if they're clotting too much, but otherwise there's nothing for it. And I got the notion a couple months ago, heck, why not do ozone? So I contacted the embassy of Sierra Leone, and they didn't show much interest. That was July. In fact, they wrote me back or called me back and said, we think the epidemic's under control, and 3 days later, doctors are dropping like flies. And through a series of events, I actually got put in contact with a key physician in Sierra Leone, and then to the office of the president of Sierra Leone, and they are extraordinarily interested in ozone therapy because it is a novel treatment that has virtually no toxicity. In fact, we don't know of any toxicity for ozone, although who knows what's going to happen with somebody infected with this virus. That is extraordinarily anti-infective. That's number one. And I say extraordinarily because its mechanism of action on bacteria is literally to punch a hole in the membrane of the bacteria, and the bacteria spills its guts out. It's like being shot with a bullet, and it hemorrhages. With viruses, ozone can inactivate the virus, and it can inactivate the virus 10 times faster than chlorine. And chlorine is being used overseas right now For Ebola, to disinfect clothes, their isolation suits, etc. But ozone disinfects 10 times faster. It's the most powerful natural oxidant in the world. Ozone also has the advantage of stimulating the immune system, modulating it. And Ebola, actually, if you look online, they're saying that Ebola itself might not kill you. It's your own immune system, because Ebola hijacks it, suppresses it, and then when your immune system finally realizes it's there, it comes out with something called a cytokine storm. And that cytokine storm leads to massive tissue destruction and leakage of your capillaries. So that's why you get hemorrhage. So ozone modulates a cytokine storm. It's anti-infective. It improves circulation. It improves the rheologic properties of blood. That means blood flow. You're going to get better blood flow, and it improves oxygen delivery. And finally, it probably, when I say probably, we actually haven't measured the mitochondria, but indirectly we have. It upregulates mitochondrial respiration, generating more energy in the cells, and that's what you need. And when you have an infection, and in fact, any healing process, the most important thing you need is oxygen to get to the tissues to make energy to heal and to quell inflammation. And I see that every day when I treat a knee with arthritis. Shooting ozone into it, even once sometimes, gives such a dramatic effect the patient doesn't come back, because it stimulates healing within the joint and quells the inflammation that's causing the pain and destruction.
Well, thanks for the excellent summary. And just wanted to give my perspective on it, because it does appear that there is a drug, although I'm not sure that's the best term for it, but there's a treatment which is basically a passive antibody that's been developed, and it's called ZMapp, essentially extracted from mice and then grown in tobacco plants, and very costly to produce. And it's not commercially available at all. It's a very low scale, but it seems to work early on because it works with the body's immune system. It just kind of slows down the increase in the viral load, so the body has enough time to respond and not get killed by the cytokine storm. So it sounds like the ozone therapy has two methods of treatment. One is it's directly toxic to the virus, and then also it enhances the immune system. So maybe you can expand on that and how it compares to ZMapp.
Well, I don't know much about ZMapp. I'll say that it's going to be extraordinarily expensive. I think everybody knows that. It might be produced in limited quantities, and it works indirectly. Ozone works both directly and indirectly. It kills virus, period, end of story. It kills bacteria, end of story. And somebody's going to say, well, why doesn't it kill our own cells? Ozone is only hard on the lungs. It can be given any other way. It can be given intravenously. It can be given in the bladder, in the vagina, in the rectum, by injection, anywhere. It's just it can be tough on the lungs. So you don't want to be breathing it. I don't want your group to be led astray on that issue.
Sure.
Also, the way ozone can be done is dirt cheap. And in a place like Africa, where there's thousands of people with this and there's just no money, can you imagine what it will mean to the planet if we can treat this disease with a therapy that will cost probably less than $10 per patient? Now, compare that to the antibody you were talking about.
Yeah, and that antibody, aside from being extraordinarily expensive, has to be given in a very narrow window. The first patient to die of Ebola within the United States died 2 days ago, as we're filming this, we're recording this rather, and he was actually given ZMapp, but he was given it like 2 weeks or 18 days after the infection, and you have to give it, it didn't work, died. So you got to get it early enough, and ozone likely could have rescued him. There's some other questions, is that they may have given him antibiotics, like fluoroquinolones, which actually also serve to decimate his infection, his immune system, because they're not going to help treat a virus.
Exactly. It appears from what I could read that when he was turned away initially, he was given an antibiotic. And, that's so sad because that's American medicine. Go to the emergency room or go to the doctor, have a fever, you don't feel well, here, take this antibiotic and go home. But the majority of what we're treating are viruses. An antibiotic, if it does anything, it's going to hurt you.
Yeah, and it does that through damaging one of the most potent components of the immune system, which is the gut flora. I mean,
Exactly.
How could you decimate your gut flora and ever hope to recover from this type of viral infection? I mean, if you ever looked at it carefully, there's no other rational response than say, what the heck are they doing?
I'm in full agreement with you.
So maybe you can expand and give us what you hope to accomplish in Sierra Leone and the time frame, because you're leaving in a few days, aren't you?
We're leaving a week from yesterday, and we should be in Sierra Leone a week from tonight, and probably maybe even getting to work on Saturday morning. This is what I'm told by the physician, that the government has set up an Ebola center that's separate from the international relief centers. And this is going to be our center to work. And my plan, I'm a clinician, remember that. I'm not a scientist, and I'm going to have to get some science now, because my plan is to divide the Ebola patients that are seen, and for the viewer, I want you to know, I'm not planning on treating the Ebola patients myself. So yes, there is danger going there, and there's concern. But our goal is to train their local health professionals to do the treatment, which we will oversee. So no doubt I will have to walk into an Ebola treatment facility fully suited up, but I don't plan to lay hands on the patient. That's going to be done by someone else.
Well, worst case scenario, if you did get infected, you've got the treatment.
I intend to do the treatment on myself and my team every single day, without question, from the day of arrival to many days after I leave. So this is not a worst case scenario, it's routine. And I will do this on myself, and we'll be sure all of us are treated. I have less fear about Ebola with this, and I mean this, and I'm speaking honestly. Yes, Ebola is a fearsome disease, but I know the power of ozone and oxidative therapies. I know it. I've lived it since 1986. So I wouldn't be doing this if I didn't have absolute confidence that we're going to dramatically cut the death rate. We'll never 100% cure anything. That's out of the question. My own belief is that if we divide them up into three groups, Group A, B, and C, A is early, as soon as they start getting symptoms. Group B is moderately advanced, and Group C is pretty bad. And maybe hopefully we'll get to do a few Group D near death. I mean, just prior to death, because they need to have, I just don't want to let them die. But let's talk about Group A. You've got a fever, you're feeling bad, you got a headache, you got some nausea, and we know you have Ebola because your test is positive. My own belief is we will slash the death rate in these people. That's what I expect to see, or I wouldn't be doing it. And if we do that, we're going to give a lot of hope to the world. And why do I say that? Because if you look at ultraviolet blood irradiation therapy, Ozone's sister therapy, in the American Journal of Surgery in 1947, this is a key prestigious journal, it detailed 445 consecutive cases of acute pyogenic infections. Pyogenic means bacterial infections at the Hahnemann Hospital in Philadelphia. Of which, now let me correct myself, about 225 of the 450 cases were consecutive cases. There's your double-blind controlled study. It's approving. It's consecutive cases. These are people with bacterial infections who otherwise couldn't be treated. This was when antibiotics were in their infancy. Of those they caught in the early stages, they had virtually a 100% cure with ultraviolet therapy. Where did this go? We can't even do that today, especially with things like MRSA. If it was moderately advanced, they had a 98% cure. And if you were unconscious, moribund, on death's door, it had about a 50% cure rate. The doctors took pains to describe this in their writings because they couldn't believe what they were seeing. Patients with septic cerebellar infarcts, that's an infected blood clot to the brain, walking out of the hospital after a couple months. Fevers breaking from sepsis, that's bacteria in your blood. Fevers breaking in 24 to 48 hours. Viral pneumonias clearing in 72 hours. Viral pneumonias, let's get back to that. Oxidation therapy was actually born during the great influenza outbreak of 1918, that had more to do with ending the First World War than the war itself. People were dying like flies across the world. A physician in India, when India was British, named Oliver, was treating viral influenza, which has no treatment even today. And if there was an avian flu outbreak, that's how it would devastate the population. Airborne transmission, human to human, getting in your lungs and filling up your lungs with fluid. That's what he was treating. And that flu was basically an avian flu. I think it's like H5N1 strain. When he gave intravenous hydrogen peroxide, which cost a couple cents to do for materials, he cut the death rate by 50%. I'll be presenting this when I go to Sierra Leone. And his comment at the end of his article, published in Lancet, major medical journal, is, this is more remarkable because we only treated the worst cases.
So a big important question for you. There's likely going to be, I suspect, curious what your views are on it, a major suppression of the results that you get if you do achieve the results you and I both anticipate. So how are you going to spread the information? Obviously, we can help support it, but you're going to publish this? Do you think? I mean, what's your best guess as to what's going to happen after you come back?
One of two things is going to happen. Let's assume we get the results that we expect, and I wouldn't risk my life. By the way, my family is against this. My immediate medical family is against it. They really don't want me to go, but they realize there's a calamity afoot. And if it reaches our shores, all of us are in huge trouble. My wonderful wife, Terry Sue, MD, is my rock. She's supporting me. And she's the person I have to answer to. What will happen? Assuming we're successful, one of two things will happen. Because we are coming at the invitation of the government of Sierra Leone, you're going to have an actual government, sovereign government, come out and tell the world, it appears that we have a treatment for Ebola. That will make international news, and international news very quickly. I fear you're right on another hand, though, because there are commercial interests afoot that stand to make billions, maybe trillions of dollars on Ebola work, whether or not what they do works or not. Through vaccines that we know don't work, to other treatments like the ZMapp or whatever it is that it is. I'm not paying any attention to that, to be honest with you, because it's probably going to be dangerous. And even if it's effective, it's going to cost so much, it's ridiculous. Suppose we can treat Ebola and cure it for $10 a person. Huh. That's pretty cool. And that's worth going and trying to do this. Will it be suppressed? Probably yes. And I'm not afraid to tell you that my bigger concern in this, because my friends have told me this, very concerned friends, that we will be in greater danger from that, from those interests, than we will be from the Ebola itself. And I'm looking at you right now in the eye, and I'm telling you that.
So recognizing that that's a serious threat, and you're in international territories, you're not under the jurisdiction of U.S. law, do you plan on having any personal security over there to address that threat?
We sure hope to have it, especially since the government itself is inviting us. But, you know, I got to do what I got to do, Joe. And this is my life, it's my career, it's my life's work. And it's the culmination, in a sense, of my life's work, even before I reach 80 years old. So it's something that I got to do. And we're, all of us who are going, we're being guided by something much higher. And it's something that I have to do. no matter the risk, because the risk is far greater if we don't do it.
Well, I applaud your efforts, and I am excited to see this happen, and really look forward and anticipate the positive results that I believe you're going to achieve. And I also want to thank you personally for educating me about ozone. You have done for tens of years now, and I just finally woke up and realized why haven't I been doing this sooner? So, I'm embracing wholeheartedly. I would absolutely and strongly endorse and support your recommendation that everyone find a clinician who could administer these oxidative therapy, because they really are crucial. You need some type of weapon to fight these outrageous potential epidemics that might impair us, and even if not for those, for the common diseases like knee injuries and such, or knee replacements. So, the degenerative joint disease. I mean, there's so many things that's useful for, and I would strongly also encourage you to look at Dr. Rowen's channel on YouTube to see an example of what it can do for people, and so you can avail yourself to this relatively inexpensive and incredibly safe therapy with virtually no side effects.